Somebody in the family suddenly feels unwell, you rush to a doctor, they will say it is a heart attack, you have to be prepared for angiogram and maybe stents or operations. The estimated cost is 4 to 5 lakhs. You ask them, why has this happened? And they will say, your diabetes is not under control, and perhaps that is the reason. But seldom doctors will have time to spend with family and patients and educate them on what do you mean by control of diabetes. You should not expect a family today to understand what do you mean by diabetes. Therefore, it is the prime duty of the doctors to educate, and the whole aim of this video is also to let you know what do you mean by control of diabetes. In other words, what should be your sugar values at all? When you normally eat your dinner and get up in the morning and do what we call as a fasting blood sugar, without taking anything, you may brush your teeth but not even a drop of water, it should be in the region of 110 milligrams per deciliter. Say it is between 110 to 126 milligrams per deciliter, you are a pre-diabetic. And if you are having a fasting blood sugar in the high 120s or crossing 126, we call that you are a diabetic. So fasting blood sugar is the first thing which should be made sure that it is under good control. So once you have been told as diabetic and you are taking dieting, exercise and some medicines, it is you who should take the responsibility of checking your blood sugar at home periodically as per doctor's instructions, and that value should be in the region of 110 milligrams per deciliter. After that, you have coffee or tea, then maybe some breakfast, which I normally advise people to avoid, and then you will have a lunch. After lunch, after 2 hours or 120 minutes, you check your blood sugar, which we call as post-lunch blood sugar or post-prandial blood sugar. It should not be more than 160 milligrams per deciliter. By the time sugar is absorbed, your body has time to act, and hopefully these sugar values will be under good control. So that is the second thing which you should understand. So fasting sugar around 110 milligrams per deciliter, post-lunch sugar about 2 hours after lunch should be around 160 milligram per deciliter. These two tests you can get it done at home yourself, and you have to do. So if you have got a mother or father or mother-in-law or father-in-law at home and you are scratching your head, what should I give them as a birthday present? If they don't have, you just go and gift them a glucometer and also a sphygmomanometer or a BP apparatus. And once they start using it, it is very easy. They'll pick up in no time, and these are the sugar values they should check at home, and they should be made sure that they are in that range. Every third month, that is after 90 days, you get your HbA1c level, which is also called as glycosylated hemoglobin level or glycated hemoglobin level. It should be in the range of 7%. There are patients who walk into my clinic who has glycated hemoglobin of 14%. That means they have absolutely totally uncontrolled diabetes. They are sitting on a time bomb. They can develop paralysis, they can develop heart attack, they can die. And therefore, if you have a family member or you are a diabetic yourself, make sure that your HbA1c levels are in the region of 7%, not more than that. How will you achieve that? Dieting, exercise, and in the previous months, get your sugars sorted out. If you are on medications, use them regularly. Despite medications, if your values are high, go to doctor and follow up and make sure that you will adjust the dosages, because at the end of the day, it is your life and you have to take up responsibility in understanding what is the diabetes control. And if you understand and keep it under control, you will be able to prevent so many complications pertaining to diabetes. Stay happy and stay healthy.